Assalamualaikum and hi. Our group will be presenting about health and hygiene campaign in Orang Asli villages, Cameron Highlands CSR project by Alpro Pharmacy. Before we start, I would like to introduce myself. My name is Nazira binti Ahmad Yusuf, number matric 2217544.
And my name is Nur Alia Wahida binti Asli with metric number 2217740.
I am Siti Asha binti Saifuddin, metric number 2226214.
My name is Fatin Huda binti Saiful Azlan and my metric number is 2317738.
Okay, next. Our project overview is all about empowering the community with sustainable healthcare and hygiene practices, making sure they have access to essential supplies and valuable health knowledge. Next. So why this matters? Well, CSR isn't just about donation or short-term charity work. It's about creating lasting impact. The Orang Asli community faces challenges like limited healthcare access, poor sanitation, and preventable diseases. And while immediate aid helps, real change comes from long-term solutions that promotes self-sufficiency and allow them to maintain their cultural identity while improving their health and well-being. So I think I will pass it to the next presenter.
Thank you, Sister Nazira. Assalamualaikum and hello everyone. I will be presenting about the research findings segment of our CSR project. And this section highlight the current challenges faced by Orang Asli communities and explain why this initiative is both timely and necessary. So now let's begin with demographic overview of Orang Asli communities in Cameron Highlands. Next slide, please. So the Orang Asli population in Cameron Highlands mainly consists of the Temia and Simai ethnic groups, and these communities typically reside in remote post-state settlements such as Post Manson, Post Terisu, and Post Limoy. And due to their geographical isolation and limited access to infrastructure, they often face socio-economic disadvantages that directly affect their health and hygiene. And through this project, we identified about the health and hygiene concern among their communities. Next slide, please. So, besides access issue, the Orang Asli community face both communicable and non-communicable disease. And according to Mahmood et al. 2022, there is a high prevalence of infection with rates at around 70% in some cases. Meanwhile, diseases like diabetes and hypertension are on the rise due to lifestyle changes. And many children also suffer from severe oral health issues recorded by Nordin et al. 2019, while reported by Tu et al. 2024. Cultural and linguistic differences further complicate healthcare delivery. Next slide, please. The next one is Alpro Pharmacy involvement. So, Alpro Pharmacy is well positioned to lead the CSR campaign due to its expertise in pharmaceutical care and health education. Because of the capacity to deliver quality healthcare kits and to conduct many workshops, Alpro can also partner with key stakeholders such as the Ministry of Health, KKM, Jakwa, and many NGOs to reach even the most remote communities. And moving on to projected outcome and potential impact, through the distribution of medical kits and educational sessions, this campaign can help to reduce preventable disease and to improve basic hygiene practices. And most importantly, these goals align with the United Nations Sustainable Development Goals, specifically SDG 3, which is good health and well-being, and SDG 6, clean water and sanitation, stated by Babula 2021. And last but not least, sustainability risk and mitigation strategies. So, as we know, sustainability is a key concern, and the project must secure long-term funding and maintain partnership in order to avoid implementation gaps. And the role should be clearly defined through formal agreements that involve both external stakeholders and also the local community leaders. And I think that's all from me. I'm passing to the next presenter.
Thank you. So why our project will work? Next. So thank you. So why our project will work? Next, to achieve this, we developed two key areas of focus. First, we are distributing health and hygiene kits that include first aid materials, medication, hygiene products, vitamin, mosquito repellent, and also water filters. These essential help address daily health needs and improve sanitation in a practical way. Second, we conducting healthcare and hygiene workshop where community members will receive training on topics like women's health, nutrition, disease prevention, first aid, and also sanitation. These workshops are designed to be culturally sensitive ensuring the information is relevant and empowering for the community. By equipping the orang asli with practical knowledge, we can help them reduce their dependency on external medical care and encourage sustainable self-care practices. This campaign isn't something we're doing alone. We partner with Ministry of Health, JACOA, and medical professionals to make sure the initiative is effective and long-lasting. Other than that, this project also aligns with Sustainable Development 11, which focuses on building sustainable and resilient communities. Next, to ensure measurable impact, our goal is to train at least 150 individuals in basic first aid, hygiene, and disease prevention. Over the course of 3 months, we will conduct 5 workshops with expert-led guidance. We will also measure health awareness before and after training, aiming for 50% increase in knowledge within that period. By focusing on structure, hands-on training, we are ensuring that information is both accessible and also practical for the community. Next, ultimately, this project is more than just supplying healthcare items. It's about empowering the Orang Asli community to take control of their health and for the long term. With ongoing support, education, and collaboration, we hope to build a foundation for future CSR driving initiatives that continue making a difference. So I think I will end my part here. I'll pass it to the next presenter.
Thank you, Sister Nazira. So I will be continuing on the implementation steps of our CSR initiative. So our campaign is designed following a structured and purposeful approach. According to Hohnen in 2007, an effective CSR implementation should follow 4 key phases, which is plan, do, check, and improve. Phase 1 is research and planning carried out before our project started. We begin by identifying the core needs of the Orang Asli community through field research and stakeholder consultations with JACOA and the community itself. We will also analyze past CSR projects in the area to avoid repetition and increase impact. With these insights, we will craft a CSR strategy grounded in the two-way symmetrical communication model by Lane in 2003, which emphasizes mutual dialogue and understanding. Our objectives will follow the SMART framework with clear KPI for impact measurement. We will also allocate a projected budget of around 10,050 ringgit for every 100 beneficiaries and assign human, material, financial, and technological resources, including training. Phase 2 is the action and implementation, spanning from month 1 to month 3. First, we will present the CSR strategy to our close internal stakeholders for refinement and approval. Next, we will build strategic partnerships with the Ministry of Health, local suppliers, and Orang Asli leaders for to facilitate smooth collaboration. Logistics will be finalized, including securing venues, materials, necessary permits, and Alpro employees will be trained following by community engagements. The campaign will then be launched officially with the distribution of health and hygiene kits and the execution of 5 healthcare and hygiene workshops. Phase 3 is the evaluation taking place in month 2 to month 3. Here we will track progress using our KPI and gather feedback through surveys, which is Google Form for the employees and printed materials for the Orang Asli. This evaluation will help us measure effectiveness and identify areas for enhancements. Finally, the phase 4, which is adjustment and reporting. Based on the evaluation result, we will refine our strategies and conduct a SWOT analysis to guide future projects. And we will compile a detailed report highlighting the outcome, challenge, impact of the campaign. So I will pass to the next presenter for the next agenda.
Thank you, Sister Aisha. Now I'll explain how we measure the success of our CSR campaign. Firstly, we focused on health literacy improvement. We used pre- and post-workshop questionnaires to assess how much the participants' knowledge about hygiene, first aid, and disease prevention improved. Our goal was at least a 50% increase in accurate responses in line with our SMART goals. Secondly, we evaluated the use of hygiene kits. We distributed them to 150 households, and within 1 to 2 months, we conducted follow-ups to check if the water filters, first aid items, and hygiene products were being used properly. This helped us see if the tools we provided were practical and effective. Next, we looked at community participation. We targeted a minimum of 75 attendants in each village workshop. A strong turnout shows community interest and trust, which is essential for sustainability. For long-term outcomes, we plan a 3-month follow-up survey. We hope to see a 30% increase in hygiene practices and a 25% decrease in preventable illnesses such as skin infections and diarrhea. We also emphasize the integration of Islamic values such as tahara, which is cleanliness, ukhuwah, which is community care, and ihsan, which is compassion, to ensure the campaign remains inclusive and meaningful to the community's spiritual and social values. The CSR impact report will be prepared, combining both survey data and personal feedback, and then shared with Alpro Pharmacy, KKM Jakwa, and local Orang Asli representatives to ensure transparency and guide future improvements. Lastly, we included media coverage as part of our success indicators through local news, social media posts, and official stakeholder channels. We aim to increase public awareness, highlight the project's outreach, and inspire similar initiatives in other areas. With this diverse yet connected success measure, we believe this campaign will leave a lasting and meaningful impact. So I'll pass the floor back to my group mate.
Next, we will look into the material examples. So let's start with the kits as presented on the slide. Each health and hygiene kit includes essential first aid items such as bandage, antiseptic, gauze, and scissors, as well as common medications like paracetamol. We will also include mosquito repellent, wound ointment, and basic hygiene products like soap, hand sanitizer, menstrual care, and dental hygiene tools to support nutrition and clean water access. We added vitamins or supplements and easy-to-use water filters, which can make a big difference in daily health and safety. Complementing these kits, we will be running healthcare and hygiene workshop in collaboration with KKM and Jakuma, focusing on first aid, the prevention of common illness like dengue and malaria, and practical nutrition and hygiene habits. We will also have dedicated segments on women's health and teaching the community on how to use and maintain their water filters properly. So together, this material reflect our goal of not just delivering aid, but empowering the community with lasting knowledge and tools. Next, I will pass to the last agenda.
Okay, thank you. To conclude, here are the key takeaways from our campaign. First, this project is more than a one-time outreach. It was planned with long-term sustainability in mind, not just to provide short-term help. Second, the reason why it will work is because we had an organized project plan, clear steps, and success measures to guide and evaluate our efforts. Third, we had strong media support. Coverage through local news and social media helped raise awareness and inspire more people to care about our monthly health issues. Next, we made sure to focus on vulnerable groups like women, children, and the elderly, making our campaign more inclusive and meaningful. We also align everything with Islamic values, as I mentioned before, to remind us that this project is both a social and spiritual responsibility. Lastly, we see this as a model for a meaningful CSR, something that is data-driven, ethical, and truly focused on empowering the community in the long run. Thank you. That's all from us.